one here. This is nodule only.
And it's something here.
I can feel it actually. She's a follow-up case of, triple negative breast cancer that was treated by neoadjuvant chemotherapy, to which she did not respond. She also got immunotherapy. She didn't respond to that as well. And in fact, there was a progression of disease. And the disease progression made us do mastectomy in this case, because the medical oncologist wanted that we now do a mastectomy in view of disease progression. She even switched on to second line also. Post mastectomy, which was the only option we had, she also received radiation. She had a node in the supraclavicular fossa, which is actually here, that had disappeared, and the axilla is also fine. Okay, but of late she's developing these tiny cutaneous nodules. So there's an entity called as cancer in Cuirasse, which can happen, especially in non-responders. And this is where I can feel a little, nodular feel, but you can see these spots. So I certainly would want an FNAC to be done, actually ideally a core biopsy from here, and it's nothing to be alarmed about. Even if it is present, it can be just excised, just this part, which is what would still be done. There is no point leaving it if it is not there. But I would not be surprised that if these are the separate areas of inflammatory origin post radiation, because she's just fresh from, when was the radiation, last
30th
radiation?
June 30.
Okay, so she has received radiation recently only. So there could be radiation induced nodules as well. Otherwise, there is nothing on the contralateral breast. Can I examine on this side, please? Thank you. We're recording. I hope that's not a problem. You're not taking the face, right? Okay, thank you. Whenever the patient is back with you, examine the contralateral breast, also the supraclavicular fossa. This is where the node was. It still is there, but it's somewhere here. This is where flex the neck, and you can actually feel the node here. But by and large, it is reduced in size. You can cover up, please. Something which was a disease that is advanced locally. It is sometimes it is believed to be due to lymphatic permeation or embolic phenomenon or whatever. So our approach would be, she has already undergone a PET scan recently. Therapy. She has received even Pembro, I mean, especially in cancer, it's found to be very useful. And in general, triple negative cancer respond very well to chemotherapy. She did not. And after how much time of radiation did you develop?
I think as soon as I was talking to her after 10 days or so, like when radiation started. 10 days after that, I was talking to her about this.
So, but there are various possibilities, right?
Okay.
And we would like
call
to.
with us also, please.
You would like to, yeah, sure. Is cancer, what I was discussing is not necessarily what you have. I was just thinking of the possibilities, but that what all that is possible is not always probable. That is also important. So I think we should get it investigated, and then we'll see what we can do from there. And suppose you are asking me if it is positive, what are you going to do? It's just that skin which has to go. Nothing, it's not a major work. Only that skin part is to be removed, and we just suture it back. It can even be done under a very short anesthesia. So don't have to worry. I'm not trying to go there firstly. Let's establish what it is. Suppose it is nothing, we are happy. What's the problem? I know what you've been through. And you're a brave, brave, brave lady. In fact, you should be an example for others to follow. Triple negative breast cancer, receiving such a lot of chemotherapy. You have done very well, and I'm sure you're going to do well. So no need to worry. When you're reading a path, you should be clear, that's where I have to go regardless. Then everything gets sorted. You getting my point? And the other thing is we are going to do it together. So relax. Okay. Question was how many triple negative breast cancer patients don't respond to chemotherapy. Most of them do, because the cells are rapidly multiplying, so they tend to respond very well. So we are quite surprised that it did not in your case. And in fact, we had to intervene for surgery because of the progression. Otherwise, we would not be doing surgery at all. We were waiting for the entire therapy to finish. You've taken the complete course. It has been treated by surgery also. But your point is valid. The question is very intelligent. Do triple negative breast cancers respond to chemotherapy or not? The answer is they do the best. What we call as a triple paradox, which means in spite of the fact that they're bad cancers, they respond very well to chemotherapy because they're rapidly multiplying. So it's unusual, yes, but that doesn't mean it's going to be worse always. Everything which is unusual is not bad. Okay? So rest assured. Sometimes the seroma gets organized, I'm letting you know. Seroma gets organized, sometimes the radiation produces that kind of response. So with both these things in mind, it is possible to observe, but we'll get pregnancy done. Any specific questions?
Specific question like
The medical oncologist
shall
is still
we
keen
wait
on.
for some time or shall we go for FNC as soon as possible?
FNAC is not going to hurt anything.
Okay.
It's just a needle.
Because its skin is already very irritated because of radiations and all that.
No, that's a good question and a good point. But that skin irritation is not going to be responsible for a lump formation, right? I don't want to take a chance with a lump which is going to grow, because at present, even if it is there, for me it is just a removal of the skin and mobilizing the flap up.
Okay.
I'll be able to manage it. There's no need to worry at all.
Okay.
Let it show if it is. See, first is to establish that it is actually.
Whether it is or not.
Let's hope for the best, right?